Assalamu alaikum. I am Dr. Rukhsana Mughal. I'm a gynecologist working in Karachi for a very long time, and I am at present I'm at also Aga Khan University as well as South City Hospital, and this is my private office where I see my patients. The reason I'm here, I've been here for the last 30 years. Reason I'm here to talk to you people as upcoming gynecologists, not working for a few years, the importance of how your association with your patients. I tell you, if you are sincere, very concerned and empathetic for the patients will be coming after you no matter what, and also you do the right whatever thing for them in a way, I mean, to be patient friendly rather than for yourself or for the hospital. All my life, what I have been doing, I have really dedicated my life in counseling the patients, because counseling the patient in all aspects, pregnancy hai, gyne ki hai, surgeries ke liye hai, and also for giving second opinion a lot of time. You should be sincere as for advising them as to which way to go. In pregnancy also, if I tell you, if you are dedicated obstetrician, your aim should not be a cesarean or abdominal surgery, because that's not what God has asked us to do. And if you are continuously working with the patient in the labor room, providing them the proper time which they should require to deliver normally, then you will see, of course, considering there should be no untoward effect on the mother or the fetus, that part you have to take care. Then you will find when these patients deliver normally, they really are, people here really like to be delivered normally. And I tell you, they will be coming after you one after the others. This is what is required, and if you have done this part, you will have patients in numerous numbers, so you don't have to do unnecessary surgeries, meaning cesarean section for the deliveries, because that spoils or damages their obstetrical career. Now comes in our gynecological aspects also. There's a lot of time you have patients with bleeding disorders who come to us. Well, most of the doctors will suggest that you have your uterus out. I don't think so. This is the way to go. We all know academically there are different reasons for bleeding disorders. These are the most two common things we see in our general practice, and there also you should be sincere to advise them that what are the options for them if they will go medically or surgically. Surgically should be the last resort, unless of course there are cancers and stuff like that. The third part is the fertility. I would advise strongly for you people to be very, very clear to the patient, counsel them again and again, because a lot of time these patients come to us after they have been seen by a lot of the gynecologists, and they have not been counseled properly. Therefore, they waste many years of their life coming from one doctor to the other and spending so much of money with no results. So when you counsel them properly, advising them, age is a very important factor, and initially after 1 year of marriage, if they're not getting pregnant, you just keep on asking them to, then you do your basic test. If you find that your first line of treatment can be done, you do it, but within a year, you can, if you are not able to manage, please refer to the fertility doctors. This is our aspect, whereas from the patient aspect, if I put it in words, this is what the patient requires, that you have to give time, talk to them and explain to them any disease, anything you come across in a layman terms. All my life, this is what I have been doing. I put those things which we diagnose as a certain medical diagnosis, and then I explain to them to what is really happening with you, as to why we are here today, and this can be rectified in this way. So I really go down to their level, use the medical terminology in their layman term, explain the little bit of physiology, and it really works wonders if you explain, and then to tell them what it will take some time for things, and then they will understand why the treatment did not work for the first instance. Because if you tell them in sequence what are the expectations, these things should be explained to the patients. They will keep, even if they are not, if they are not treated, although the symptoms will subside, they will still come back to you. But if you have not counseled them, usually what our patients do, they just will go to some other doctors, and the whole vicious circle will go on and on. You lose your patients lose their time, money, and then in the end, they are nowhere. So my advice to you, you have to counsel them because this is their expectations, and you have to be truthful and be sincere to them. Then God is there to help you out in all ways.